Okay, it is 3 o'clock, and we want to be respectful of everybody's time. And so we're going to go ahead and get started. I know we may have a few other people sign in late, but that's not a problem. So again, just welcome. I'm excited to welcome you on behalf of the Texas Health Institute to this webinar. My name is Katie Bradley. I am the Convenings and Education Coordinator for THI. And I just want to take a quick moment to introduce the rest of our team who will be on this. So our two presenters today are John Effinger and Nadia Siddiqui. John is our Director of E-Learning and Training, and Nadia is our Director of Health Equity Programs. And so they'll be presenting today. Two others that are joining us on our team today are Afrida Faria. She's one of our amazing data analysts, and so she's pulled a lot of the data that you're going to see during this webinar today. And Stephanie Andreas is our Director of Convenings and Education. And so Afrida and Stephanie are also going to be helping monitor the Q&A, the chat box, or if there's any technical issues, if you can't hear or can't see, just let us know and we will help get you squared away for that. Just to let you know, we are recording, so if you have to step away early or if you have a colleague who didn't get to see this, this will be recorded and we will get it uploaded in the next couple days and send you all a link for that. We are going to have a Q&A portion towards the end of the webinar, but if you think of a question between now and then, go ahead and submit it, and there's a Q&A button at the bottom of your screen. You can go ahead and submit, and we will answer them as we can, or we may save a few for the end of the webinar during Q&A. And also feel free to utilize that chat to reach out to one of us with any technical issues or just to make a comment and make some connections with your peers. So again, thank you for being here today. And with that, I'm going to pass it over to John.
Thank you, Katie. And we really appreciate everyone being here today. And thank you for those of you that I guess we're all starting to learn things about Zoom and others. If you want to put your name and what organization you're with in chat too, that is a really helpful help for us as well. But we are excited to have you here today. Couple of things. This is Texas Health Institute's 10th year in releasing the county health rankings. So we've been a partner with them for the entire 10 years that they have released the rankings. And what's important, I think, for us is we couldn't do this alone. It's not only just the county health rankings and roadmaps, but Jennifer Smith and our friends over at Texas Association of City and County Health Organizations, our officials, has been a key partner with us, I think, from the outset, and certainly since 2014, since I've been involved. But we also have folks from the Department of State Health Services that have been real key to this, and the Texas Association of Counties. And so a shout out to all of those folks that have really helped us begin to get the word out on county health rankings. The second thing is really appreciate your time today. I think we're all learning what it's like to, whether we call it a new reality or what, but to work in a COVID-19 environment with what's going on in our state. We know that you all have a lot of pressing demands, and so we want to make the best of use of your time. So there'll be some ways that you can connect with us that we'll talk about towards the end of this, but we appreciate your time. What we're covering here is a little bit about THI, a little bit of background on what we're doing here and the methodology for our county health rankings. And then Nadia and her work with Afrida are really the stars, because they've gone in and looked at a lot of the data in county health rankings and how does that apply with the COVID-19 lens. And I think you're going to find some fascinating information, probably a lot of validation information, but maybe some new things as well. So with that, for those that don't know, Texas Health Institute, we've been around since 1964. We're an independent, nonpartisan public health institute in Texas. Ankit Sanghavi is our CEO, and when he became CEO 2 years ago, we set out on crafting our new vision and mission. As you can see, it's healthy people, healthy communities, and to advance the health of all. And that's everyone in our state. We do that in 3 ways. We help produce evidence and ideas. Then we take and translate that and share those insights in a variety of ways. This is one of those ways. And then we have advanced collaborative action where we can do things together. And that in a nutshell is really Texas Health Institute. And if you go to texashealthinstitute.org, you can learn more about that piece. Today, out of our 9 focus areas, Nadia leads a health equity group, and I do the same for training and e-learning. So those are the 2 areas. We have 9 focus areas that you can see on the screen. And those are fairly broad in a lot of the things that we get involved in. And what we're here today, Katie, if you want to pop up the poll real quick, and then we'll talk about county health rankings. But if you could take a few minutes and fill out these 2 questions, this will help us understand who's in the audience and what your level of understanding is with county health rankings. And have you ever worked with a county health rankings and roadmaps community coach, which are just awesome people to work with? And we'll wait a few minutes for you all to vote.
Looks like most of the votes are in, so we'll give you about 10 or 15 more seconds. If you haven't voted yet, go ahead and get those in, and then we will show the results.
Very cool. So for the folks that have never visited county health rankings, hopefully this will be a good introduction, and we would really be happy to help, you know, even if it's never or 1 to 5 times, if there's things that we can be helpful for, including connecting you with the Texas community coach, we'd be happy to do that. For those that have been active for quite some time, it's great to see you here as well. And it looks like 95% of y'all have not worked with community coach. So let me take a second and just do a shout out for those folks. County Health Rankings assigns a community coach for each state. And these people work specifically with local communities that want to work with county health rankings to improve their rankings. And we'll talk about what that means in just a second on factors and outcomes. They are really, I've been working with folks now since 2014, and everyone that I've worked with up there is super supportive, really tries to help, is very responsive. And so I would encourage you that if you're interested, we'd be happy to connect you. And specifically, I would be happy to connect you, or Katie can help me with the people that are there. In terms of what the county health rankings, and I'm going to close on my screen a couple of things. What county health rankings, and particularly in the time of COVID-19, I think a lot of us in public health and affiliated areas understand that where we live matters to our health. And they have been doing this for 10 years. It provides an easy snapshot for each of our counties. And the goal really is for the counties not to be concerned about where their ranking is, but how do you go about each year beginning to take those steps to improve yourself. And so whether that's dealing with things like food deserts or some of the environmental pieces or a whole range of other issues, county health rankings is a good place to begin that step. They provide actionable data. They're really good at providing background information on what their data sources are, how they selected those data sources, and how long they've had them. And that data then is translated into very easy to understand language for us to take action. They provide guidance. And they provide the ability for us to start conveying stories back to our community. This doesn't work in a community unless you have a number of folks, a lot of key stakeholders and other organizations involved with you, and you want to make a concentrated effort in that community, even just taking a look at one particular piece. And so all of this comes together in the county health rankings on their website. They're unique in their ability to measure current and overall health. They look at measures that most importantly look at our future health, and we'll talk about that in a second. And you can use these rankings to garner support, whether that's with elected officials, other stakeholders, individuals within the community that you work with, those type of folks. And a shout out that a number of our folks that we know of work with community health workers, and this kind of information is really helpful for community health workers to take back out to the communities that they work in. Let me double check something. Yep. And so if you think in terms of health factors and health outcomes deals with our length and quality of life. Health factors are those things that influence that, and it's broken down into behaviors, clinical care, social economic factors, and physical environment. So you can see where those are on the right. But the overall piece is none of this is going to change unless we have policies and programs. I was on a call just a second ago, and we were talking with some public health people about, you know, one of the things that COVID-19 is doing is surfacing a lot of the things that have been below the surface for a long time that influence, you know, the social and economic factors, whether it's education, employment, income, community safety. All those issues are now coming to the surface because of how we have to deal with COVID-19. So if we think in terms of it's not just looking at the factors and outcomes, but how do we develop policies at that local level that are translatable into action? That's really what County Health Rankings is designed for. And this graphic has been around since, at least I've been around working with them since 2014. And it really shows essentially their overall approach, which is community members are in the center. And it's really, it's very community centered. You have a lot of organizations that are working collaboratively outside of that. And then it really follows almost a continuous quality improvement wheel. And it's a 360 piece. And so again, this is an area where there's so much on the County Health Rankings website, but they've laid it out to where you're able to get to it fairly quickly. And again, it's one of those things that if you get to the point where you really want to make a conscious effort is in the community to take one of these areas and try to improve that ranking, those community coaches are there to help you do that. And so that's the value of having both the people involved as well as the data in the website. So with that, Katie, do you want to pop the next poll real quick? So have you utilized any County Health Rankings data before? And now that we're in COVID-19 to inform your COVID-19 related response and action. And there is an area on the County Health Rankings website that deals with COVID-19. Ripe opportunity for some new areas and information. So thank you all for taking part in the poll. And if we think in terms of how to take action, I think all of us realize this is a totally new world, or at least in significant ways, it's a new world with COVID and how we're having to deal with it in all of our counties. Every county and every community has things that affect them specifically and is a little different. The one thing that's becoming pretty common across our state, though, is that we're all having to deal with COVID-19. And just in terms of numbers, it's irrelevant because we're all facing the same virus that's out there. And so how can we take action and use this time to improve health? And again, going back to the County Health Rankings website, there's a lot of searchable menu for evidence-based policies and programs. There's some that's starting to pop up on COVID-19, but here's an opportunity for any of us to begin helping to inform what are evidence-based policies and programs as they relate to COVID-19 that impact this. They have, again, good step-by-step guidance and tools, self-directed learning, and I can't say enough about the action or the community coaches. Everyone that we have been involved with has worked with folks. I've seen that we have a couple of folks from Bastrop and some of the other counties, I think, that have had community coaches work with them before. And I would strongly suggest that if you're actually thinking about how to begin influencing health outcomes in the future by focusing on a health factor, or even a specific one, working with a community coach at County Health Rankings can help you give an outside lens and help you take some steps and point you to some information that's worthwhile. And with that, I think it's going to be time for me to stop this and let Nadia take over and talk about what she and Afrida have uncovered. So again, we appreciate your time, and I'm going to go back to being mute.
Great. Well, thank you so much, John. Welcome, and thank you all so much for joining us today. I want to be sure that you all are able to view my screen. Thumbs up. Okay, wonderful. Great. We are going to get started. Well, thank you, John, again, for setting that context. I am going to take it upon myself to really share with you all what we have uncovered as we've started to look at COVID-19 data side by side with the county health rankings data for Texas and our counties across the state. Before we proceed any further, I do want to set the context with a definition of health equity. It's always helpful to kind of start from that baseline. We rely on Dr. Paula Braveman and Robert Wood Johnson Foundation's definition of health equity, which means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles such as poverty, discrimination, and their consequences. And for the purposes of measurement, health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect marginalized communities and communities that are most in need. So with that, let me launch in. So what we have here are three maps. The left two, the green and blue, are from county health rankings, and we are looking at the rankings data side by side with the orange map on the right-hand side, which are COVID-19 cases per capita. And it's important to see here the fact that what's going to come clear and true from here is that in Texas, where you live matters to your health. And so on the left-hand side, what you see is our health outcomes map, which is what ranks counties based on two key measures: how long they live and how well they live. And how well they live is based on perceived health status. Now, what you'll see is those counties that are in the darker shade are the counties ranked at the bottom. So they have the poorer health outcomes. And those counties tend to cluster across East Texas. You'll see the Panhandle, South, the Valley area. You'll see parts of West Texas. Now, mirroring those outcomes and where they're locating are the health factors map you see in blue here, where the inequities and health outcomes are really a direct reflection of the inequities we see in the broader social determinants of health and the social, economic, broader opportunities that people have to lead healthy, prosperous lives, which County Health Rankings refers to as health factors. And those same inequities, those systemic inequities in factors, in outcomes, is exactly what we're seeing playing out across our state amid COVID-19. Where a lot of the places with the greater clustering of cases per capita are in fact those that have faced systemic inequities. Now, this year County Health Rankings is highlighting the importance of identifying and addressing child poverty as a pathway to improving community health. A healthy beginning is essential to a healthy future for our children in our communities. Children in poverty is a measure of both our current communities, but the opportunity for us to really improve the health of communities in the future as well. And so what we find across Texas and what is graphed here and we'll walk through is the fact that there are patterns of unfair and avoidable differences in child poverty by place and race. So what that means is not only does where you live impact your health here in Texas, but your race impacts your health and your health outcomes. So what we have here is to the right, you'll see every orange dot is a county. And so you'll see the very top one, or the very top cluster is, let me see if I can move my mouse over. Okay, so the top cluster here is where all counties fall on child poverty rates. And so you'll see 21% of children live in poverty in the state of Texas. But when we start breaking that out by county and by race ethnicity, we start seeing how wide those gaps are by race and by place. So let's start at the bottom with percent of children in poverty, white children in poverty. You'll see that those rates are clustering pretty tightly. But when you compare those rates to Black and Hispanic children, you'll see just how wide the inequity and disparity is. We have Hispanic and Black children in this state. There are counties where more than 50% of children live in poverty. It's about 36 of these counties. And those rates go as high as about 2/3 of children to anywhere to 75% of children living in poverty. And so again, child poverty is a very important measure of both current and future opportunities for health. And it has relevance in the now time and, amid this pandemic, for the fact that, we're seeing challenges with housing, with employment, with food security only being further exacerbated amid this pandemic. And these are all factors that are going to only further exacerbate and raise the rate of child poverty in this state. And so inequities really by place and race have only been amplified by COVID-19. And we see this playing out across the state in our hotspots, whether we consider the urban counties, the rural counties, counties where there have been outbreaks in meat packing plants and prison systems. We are finding that there are wide gaps and wide racial and ethnic inequities where Hispanic and Black residents within our state are facing a disproportionate burden of disease and death. And so we're going to walk through these data and pair them with county health rankings data, where you'll begin to see that Hispanic and Black residents across the state and in these hotspot areas are those communities that have been facing greater social, economic, and healthcare challenges. And so as you go through this and as we begin to move toward our discussion, it'll be very important to begin to think about, well, how can county health rankings and this data and this juxtaposition really help me or help us move toward action? We're really going to strive to begin to pair these data together to try to provide some bit of contextual data on how and why maybe we're seeing some of these inequities. But we feel this data will also help to prompt urgency to the need to get to the root causes, those conditions of health that are so necessary for us to address for any kind of sustainable response and recovery. And we're also hoping these data will help move us beyond conversations toward really driving action. So with that, I will start with Houston-Harris County. Harris County is the third most populous county in the United States. And we are seeing, just because of its sheer size, a very large clustering of cases emerging here within this county and area. Important to note the fact that race ethnic data amid COVID-19 are emerging. These data are not complete. There's a lot of gaps still that are to be filled. And so here, for example, in Harris County, you'll see that our race ethnic data on the left-hand side for COVID-19 cases by race ethnicity are based on 60% of reported cases for which we know race ethnic data is available and has been reported. As I go through other counties and data, you'll see there's a mix of the amount of availability of data by race, ethnicity. And so here in Harris County, you'll see that emerging data are showing that Black and Hispanic residents in Harris County are facing higher COVID-19 cases. So for Blacks, for example, while they comprise 19% of the Harris County population, they comprise 22% of COVID-19 cases. Similarly, our Hispanic residents in Harris County, while they comprise 43% of the population, they make up half of the county's COVID-19 cases. And when we look to the right-hand side in terms of what county health rankings presents as key social determinants of health and health outcome data, we see the same kind of inequities playing out. The fact that Black and Hispanic residents in Harris County are in fact facing a set of socioeconomic challenges and systemic barriers to health. So when we look at child poverty rates, for example, Black and Hispanic children in Harris County have 4 times the rate of poverty as compared to white children. When we consider income, Black and Hispanic residents in Harris County have half the income that their white counterparts, and even lower incomes than Asian Pacific Islander population groups as well. And Black residents in Harris County have higher mortality, premature mortality rates. And these are, a large proportion of these are due to cancer, heart disease, diabetes, all those risk factors that are also underlying risk factors for COVID-19. When we move to Dallas County, which also has a very high number of cases, as another one of our hotspots that we've been monitoring, we'll see even more stark disparities for Hispanic population groups. And so while Hispanic residents comprise 41% of Dallas County's population, they make up twice as many of the cases. So they make up 75% of COVID-19 cases. And when we consider some of the county health rankings data, again, we find that our Hispanic residents and children in particular have 3 times the rate of poverty as compared to white children. Hispanic residents also have a much lower income than white and Asian counterparts. Now, also included as I go through, and I won't have the time, in the interest of time, I won't touch on all the data points, but in front of you, you'll see other measures included, such as rates of uninsured, food insecurity, severe housing cost burden. So this is families spending more than 50% of their income on housing. They're severely burdened by housing costs and unemployment rates. And you'll see we've captured pre to post unemployment rates just as a point of reference and to further contextualize kind of where these counties fall in terms of their data. Now, when we move to Travis County, the data are a little different. This is where, as we were going about and our team and our Frida in particular in pulling some of these data together, what we came to learn very quickly was that number one, not all counties are reporting race ethnicity data. Number two, when they're reporting the data, it is being captured, it is being reported, it is being displayed in variable ways. And so Travis County, for example, separates out their race and ethnicity data, and so that's what you'll see captured here. So separately, when we look at the Hispanic rate of COVID cases on the left-hand side, we find that Hispanic residents in Travis County have twice the rate of COVID-19 cases as compared to their share of the population. When we look at and consider some other differences, we see that Black residents in Travis County have a higher fatality rate than would be expected. So they make up 9% of the population, but they account for 12% of COVID-19 deaths. And again, what's really important to point out here in Travis County is just how wide the socioeconomic gaps are. even wider than what we saw in Dallas and in Harris County. So let's look at child poverty, for example. Black and Hispanic children in Travis County have 5 to 6 times the rate of poverty as compared to white children. And again, when we consider median income, Black and Hispanic families have almost earn half as much as their white and Asian counterparts. Now, these are important data points, and it's notable how wide these gaps are, because County Health Rankings actually ranks Travis County number 2 for health outcomes and number 12 for health factors. So on the surface, it may look like our communities are prospering, we're doing well, but it's not until we start disaggregating the data, and particularly by race, ethnicity, and other socioeconomic factors, that we come to learn just where those gaps are. And this has particular relevance as we think about response in the immediate term and long-term recovery from COVID-19 in Travis County, that it will require focusing according to population need. Here's Baer County. Again, you'll see some similar findings. I think what's really notable here, so Hispanic population groups do have higher COVID-19 cases. Of note, Black residents in Baer County have 2.5 times the fatality rate as would be expected given their share of the population. And similarly, as we've seen in other metro areas, we see that these two population groups are also facing deep socioeconomic challenges in Baer County, including higher child poverty rates and lower median income. We find consistently that Black residents do in fact have the higher premature mortality rate across our urban centers. Now we're going to move to some of our more rural counties. So we see very consistent patterns, wide inequities for communities of color, particularly Hispanic and Black residents in our metro areas. What's happening in some of our rural counties? And so here you see data for East Texas, and we've clustered 7 counties together. These are the 7 counties that the Northeast Texas Public Health District reports data on, and so that their dashboard really provides some great information and data by race, ethnicity. And so here you'll see in East Texas, what we're finding is that Black residents have more than twice the rate of cases than would be expected given their share of the population. Whereas Black residents comprise 11% of the population in these counties, in East Texas, they account for 27% of cases. And when we look again, we see that similar patterns of socioeconomic and systemic barriers playing out. But of note are really the disproportionate impact of systemic barriers on our Black residents in East Texas, where 45% of children in East Texas live in poverty. That's 3 times the rate of whites. That's even higher than the Hispanic children, Asian children, all other groups. It's a rate that's higher than some of our metro areas. And so, you know, it's not surprising to see higher rates of child poverty in our rural counties. There's an association between poverty and rurality, but just how high these rates are really is a cause for attention. Median income as well is very low for Black residents in East Texas and in our rural counties as compared to all population groups, and premature mortality rates are far higher as well. Moving into some other counties up into our Texas Panhandle, Moore and Potter counties, which were really the center of outbreaks in the large meat packing plants. And while we could not identify and pull race ethnic data, what we do know is that these meatpacking plants actually include a very large staffing of immigrant refugee population groups, refugees from Asian countries, from African countries, from Latin America. And so we're talking about very diverse population groups here as well in these communities, but also working within these meatpacking plants. And as you'll see, the per capita was very high in these communities because of the outbreaks that occurred. Now, I do want to also highlight the socio-demographics and the socioeconomic challenges in these communities and the population groups they're affecting. This is where we see in Baer County, for example, child poverty rates for Asian children is much, much higher than all other groups. I did not know this. This quite honestly came as a surprise. Other child poverty rates as well, very high in some of these communities, as well as disparate varying income levels. And then we've got our counties with large prison systems where we're seeing very large outbreaks as well. In fact, cases across these prison systems account for 7 to 9 times the cases than regular community members. So again, we could not pull data on cases within prison systems by race, ethnicity, but we do know that our prison systems are in fact comprised disproportionately of people of color. In particular, 33% are Black and 33% are Latino. For instance, Black Texans comprise 13% of our population, but 3 times higher rate of comprising our prison population. So again, this is another group that is being disproportionately impacted by this pandemic. And so through all that, the question becomes, what do we do with all this data? How do we move from data to action? And really, I want to spend these last few minutes presenting kind of an opportunity on how to leverage some of the tools and resources that County Health Rankings provides to drive and move communities toward action. If you have not already visited County Health Rankings Action Center, I would highly recommend it. There's some great information and research on evidence-based programs and policies and initiatives that counties are undertaking that would be just a really rich resource to draw on. What you see here is a screen capture of the Action Center page, and this builds on what John presented on the 5-step take action cycle. These are kind of those 5 steps that they've laid out. And if I go through each just very quickly, assessing needs and resources. This is the time not only for us to be monitoring the COVID-19 data very closely, but really demanding and moving toward disaggregation of that data so that every county is reporting race ethnic data. And I know that our state government and DSHS will be taking on a study to assess race ethnic disparities. And I think this is just such an important step, but we really need to understand what those gaps are by race, ethnicity, and also consider what are the underlying contextual factors driving those gaps and those inequities. What are the underlying social, economic, systemic barriers facing our communities? Because until we don't address those factors, it will be very difficult for us to address these kinds of scenarios in any kind of disaster situation. So County Health Rankings can help provide some of that contextual information. From there, we can start focusing on what's important. And the way to get there really is to engage our communities, engage our community partners, and even more so in this time. I know so many of our partners are out front and center in the communities trying to assess and understand their needs. There are groups also leveraging technology to do virtual focus groups or engaging partners in new ways as well. So we've really got to work with our communities and hear their voices and understand their needs to prioritize programs and interventions. Identifying and choosing effective policies and programs, which is step number 3. And this is something the Action Center can really provide kind of a starting point with their library and menu of resources that they include. From there, moving into cross-sector action, engaging communities in the process, working together, working across sectors. And the fifth is evaluating actions. And this is one at Texas Health Institute that we're actually committed to from the very beginning. Evaluation should not be an afterthought. It's got to be something that's built in from the beginning. You know, had we had some quality race ethnic data, we really would have been able early on pinpoint some of these needs and potentially mitigate the adverse impact we're seeing across some of the communities. So really, really crucial to evaluate, to build on and assess and understand off of disaggregated data. And finally, then, you know, we recognize here at Texas Health Institute that no one entity can move the needle on achieving health equity, that we have to and must work together collaboratively to really move forward. And we recognize that because health is impacted by where we live and broader social, economic, and environmental opportunities around us, that we must find solutions beyond you know, the four walls of our clinics and hospitals and healthcare systems, that solutions must engage across multiple sectors. And so as the state's Public Health Institute, you know, as we open it up for discussion, I put this question out to you all. How can we leverage our role in our partnerships and work to help advance not just the conversation, but action to really make health a reality for all Texans? How do we move forward together from here in this crisis, in response to this crisis, but to where we're beginning to really make some lasting changes in our communities over time? So with that, I want to give a big shout out to our entire team, without whom this would not have been possible. And then we've got our contact information. And Sean, if you want to quickly mention in community before we close out for discussion.
Thanks, absolutely. You will be getting some information from Katie, I think, when we send it out also. In community is Texas Health Institute's collaborative learning community. Essentially think of it as a Facebook, Twitter interface for a place for us to carry on conversations between meetings or after webinars and things of that nature. Nadia is a co-organizer for one of the interest groups in there that deals with community issues. And inside there, we have documents, a document system that has all of our documents from county health ranking going back to 2014 in individual year folders. And so the Texas report, the outcomes and factors images and PowerPoints and things of that nature are all in there. And then we have a specific discussion set up for this webinar. So if you're interested, you still need to sign up, which gives us the ability to kind of curate and see where everybody's coming from and be sure we have them set to the right group to talk with or to converse with. And then once you're in there, you have access to this information. And so if you have an interest in that, we'd be happy to include you in there. But just follow up on the links there. Did that answer it, Nadia?
Yes, absolutely. Thank you so much. So at this time, we can open it up for some Q&A. I know we've gotten some questions rolling in. Afrida, are there any that you'd like to roll to the top?
Yeah, sure, absolutely. We did have a few come through. I guess the first one we can start off with is from Miguel Smith. The DSHS COVID dashboard shows that across the state, whites make up 26.4% of cases compared to 36.5% Hispanic, but account for 41% of confirmed COVID fatalities compared to 25.8% Hispanic. Why is this different from what we see within many of our highly populated counties?
That's a great, great question. And so, you know, I can't speak to 100% why we see this difference, but I can relate to a couple of points. Number one is overall, actually there are 3 points. The number one is not all counties are comprehensively reporting these data. And so the quality of data at a county level is very limited. And so when we start aggregating up, there are already holes in the data. Number two is, as I'm looking up, so there's, I don't know if you all are familiar with the COVID tracking project, and they have a racial data tracker. They also track the quality of race ethnic data for every state. And so I just pulled it up. Here's what they say. Texas has reported race and ethnicity data only for 11% of cases and 23% of deaths. So that's how large our gap right now is in the quality of data statewide. But then also we're seeing this is the case. Some counties are doing a fabulous job of collecting and reporting where they only have 10% of missing data, which is very good quality data. And there are others that are either not reporting or are reporting with very big gaps and are still kind of working through backtracking to compile all the race ethnic information. So I hope that's answered your question.
And just to follow up of the question, we have a few more from Heather. How do we get counties to report disaggregated data?
That's a great question. I almost wonder if that's, and John, I'll invite you to answer, but almost wonder if that will require some bit of advocacy and some bit of really having conversations with our county departments, as well as more statewide advocacy to be able to do it on a more standardized way.
Yes, agreed.
Thank you. That was a great question.
Yeah, and part of this is, let me double check some. Part of what county health rankings and Nandi can speak to even American Health Rankings faces is collecting data that's consistent across all 3,200 local jurisdictions. And so I think that what we're hearing, while County Health Rankings has done a really good job about, adding to the data mix as we've gone forward, COVID-19 is surfacing all the things that we've known inherently or intuitively in public health for a long time to a more public setting. And so how do we get access to some of the data that's out there in subpopulations, whether it's different ethnic groups or other types of groups as well. And so I think that's a really good piece for us to start thinking in terms of, I know that in one of our THI's projects on transgender health, we're making a concerted effort, not only in communities of color, but specifically also in trying to identify and work with Asian groups. So, I think this is something that we should be thinking about as we go forward over the next year.
Yeah, absolutely. And we're striving to do that too when we do community health assessment and survey work as well. And not the formal community health assessments that are required for, nonprofit hospital systems, but really with the purpose of improving health in communities beyond that requirement. And so we've started really engaging and partnering with diverse community-based organization groups that are anchored within their communities and are able to then collect data by disaggregated Asian and other subpopulation groups. And so we're actually getting ready to put out a report on Southwest Houston where we do break out health and social determinants of health data by Asian subpopulation groups. We're also disaggregating, in fact, the Black community where we have, Black Americans compared to those who have immigrated from African countries, because they have very different needs and characteristics. We are also disaggregating some of the Hispanic population groups as well. So this is so needed, and we're really committed to advocating and really working with our partners to move more and more toward data disaggregation.
Yeah, and along that line, I'm wondering about, I mean, Nadia, you're in Harris County area, but you know, with the last I remember from Harris County Public Health, there were 145 dialects, of which a large number of those are Asian dialects. And so if you're starting to disaggregate data, how are you getting into all the different sub-communities? How far down can you go? And what was surprising to me, I think, was learning, it shouldn't have been, but it's just one of those data points that, you know, in Deep West Texas, there's large Asian communities in certain areas. And so, and I grew up in West Texas. So that's a change that we see. And so I think a lot of, if we, you know, I hate to say anything positive about dealing with COVID-19, but one of the things it's forcing all of us to do is think differently and look at things in ways that we haven't looked at before. And so raising these kind of questions is really a good idea for us, because whether we can solve it or not at this stage, maybe there are other people we can connect with, and together we can figure out how to gather the data that makes sense and appropriately describes the narrative of the different communities.
Sure. The next question from Jackie: is data collected on the rate of seeking healthcare, when any?
Could you repeat one more time? Or
Sure. So is data being collected on the rate of seeking healthcare, when any?
It's when any type of illness is begun.
Any is begun, yeah.
I don't have an answer to that. That's the beauty about county health rankings is they have the data, the sources, why they selected them, what the methodology is, and how frequent it's updated. That's a great question. Nadia, do you know?
Well, and I wondered if that was being asked in context of COVID-19 illness, or if it was asked more generally speaking. So I know County Health Rankings includes a pretty broad menu of clinical care measures, many of which come from BRFIS, the Behavioral Risk Factor Surveillance System. So would highly encourage you to explore if it was a general question. I am not certain if I have an answer to even that question related to COVID-19.
Yeah, I think that's going to be the key, because things are changing so much dealing with clinical. I mean, what we were pre-COVID and post-COVID, I think at least it looks like it's going to be two different environments in terms of the numbers. And so it would be, I think it'd be really helpful to understand what it is that they're collecting now for next year's survey. That's actually a good question to pose with those folks. And I'll reach out to both Justin and Joe up there to see if I can see what they're doing. That's a great question. Thank you.
And then we have one last question, which was asked before. And I think this is in context to COVID. Are data collected on gender and sexual orientation? That person would be interested on how transgender folks and others in the LGBTQ community are affected by race as well.
That one I can answer because I co-lead Texas Transgender Health. No, there's the good news is County Health Rankings hired a community coach 2 years ago who is focused on LGBTQ plus issues. The issue is trying to find where we have data across all 3,200 local jurisdictions, when in fact the federal government and most state governments do not count LGBT people. And so you can rely on things like BRFIS and some other areas, but that doesn't cover all 3,200 local jurisdictions. And so I know the person who asked that, and I will follow up with her, with they, and they. And I think that there's some opportunities, because I know that County Health Rankings is very interested in wanting to try to figure out how to do things, and we certainly are within the state of Texas. And we've done a Texas survey to understand the demographics or lack thereof in all 254 counties.
All right, with that, it doesn't look like we have any other questions coming in. So, and we're getting close to our time, so I'll give you 4 minutes back in your day. Thank you again, everyone, so much for being here. We really hope this was a valuable use of your time and that you learned something that you can use moving forward in your organization. I just wanted to let you know that after you log off of here, you'll be taken directly to a survey. It's really brief. We'd love to hear your feedback on how we did today and how we can better serve you in the future, if you'd be willing to take that. And we'll also be sending a follow-up email in the next day or two that also has that survey link if you don't get to it, as well as the link to the recording of this webinar, and a link to join in community that John mentioned earlier. So thank you again, and I hope you enjoy the rest of your afternoon.